This is an analysis of the Safety Harbor community presented to you by Ashley Grindstaff. The objectives of the presentation are to provide a detailed information about the City of Safety Harbor and its historical background, an analysis of the community structure, population, health-related resources, environment, and government and public policy will be discussed. 6 prioritized community needs and 1 global issue will be examined. The overall purpose of the presentation is to incorporate the nursing process and public health concepts from the perspective of the community health nursing practice. In the 16th century, the Tocobaga Indians were said to have inhabited Safety Harbor and believed the mineral waters found there held healing powers that could cure the sick. In 1539, a Spanish conquistador named Hernando de Soto was said to have discovered 5 natural springs. In 1842, Odette Philippe, the area's first permanent non-native settler, gained 160 acres of land and developed cigar making and citrus to the area known today as Safety Harbor. This healing restorative place is known as the Safety Harbor Resort and Spa. The spa is known as Florida's first spa and sits on 22 acres. In 1970, the Safety Harbor Museum and Culture Center was created as a way to trace the colorful history of Safety Harbor. Safety Harbor became a city in 1917 with a population of 200 people. Today, Safety Harbor sits on 4.9 square miles of land and is home to just over 17,000 residents. The Safety Harbor Resort and Spa continues to be a major attraction for tourists and residents alike. This city is known as a family-friendly community and business thrives in the downtown historic district. The real estate in Safety Harbor mostly consists of homes, such as houses and apartments, which adequately meet the needs of its residents. The average amount spent to buy a home in the area is about $156,200. The average amount spent to rent in the area is about $998. The city adequately meets the needs of its low-income residents by offering low-income housing. U Park Housing is a low-income housing development subsidized by the federal government for disabled persons. This is similar to programs in neighboring communities. There are only 2 schools located in the area, which consist of a middle and an elementary school. There are 2 high schools, but they are located outside of the city limits in Clearwater. There are no higher education facilities, and the closest one is in Tampa. In comparison, other cities are better able to meet the educational needs of the community. There are 25 computers available for printing and scanning in the public library. The library includes a story-hour room and space dedicated for teens. This library continues to offer new technologies, programs, and outreach to the community. Safety Harbor encourages physical activity by offering numerous parks available to the public at no cost. In comparison to other communities, Safety Harbor has more parks than other surrounding cities. For hundreds of years now, the Safety Harbor Resort and Spa has been highly treasured, and many seek relaxation and comfort here. This resort and spa is internationally known, and many travel across the world to visit this iconic place. The community offers fishing, shopping, downtown dining, and access to beautiful parks. The newly restored museum represents the colorful history of this small community and offers field trips, classes, and a children's highly praised summer camp. Safety Harbor has a high percentage of adults being 65 years or older at 32%. According to the CDC, heart disease and cancer pose their greatest risk as people age, as do other chronic diseases. Safety Harbor has a higher percentage of Caucasian persons at 89.7%. This is higher compared to Pinellas County and the state of Florida. This racial disparity may lead to even more racial segregation. In conjunction with the concentration of poverty and growing economic inequality, results in growing isolation of poor minority households. This may lead to minorities living in poor and more problematic neighborhoods, therefore further contributing to economic disparities. 37.8% of residents in Safety Harbor are college graduates, compared with 28.3% in Pinellas County. This community values education. According to the CDC, people with higher levels of education and higher income have lower rates of many chronic diseases compared to those with less education and lower income levels. Sexually transmitted diseases such as chlamydia and gonorrhea were the primary communicable diseases in Safety Harbor. In comparison to other nearby counties, the rate of STDs are much lower in Safety Harbor than other neighboring communities. Cardiovascular disease and cancer were the leading causes of death in Safety Harbor, as well as neighboring cities and the state of Florida. These diseases are strongly associated with poor diet choices and lack of physical activity. The comparison of health concerns shows a strong need for the people of Safety Harbor to engage in more physical activity, make better dietary choices, and to stop smoking. Palamed Walk-in Clinic is the only available clinic in Safety Harbor. There are urgent care centers, but they're located a short distance away in Clearwater. Palamed accepts a variety of insurance and Medicaid and Medicare as well. They do not offer free services. The closest health department is in Clearwater. There's one hospital in Safety Harbor that is able to meet the needs of the community. They accept all patients regardless of insurance and will work with the people to meet financial needs. There is also a variety of other hospitals in the area, such as Morton Plant in Clearwater and in Dunedin. There are also several assisted living facilities, a nursing home, and a behavioral health care clinic. The following Healthy People 2020 objectives were chosen for Safety Harbor. Initiative HDS1 aims to increase overall cardiovascular health in the population through prevention, detection, and treatment of risk factors. Heart disease and stroke are among the most widespread and costly health problems facing the nation today, accounting for more than $500 billion in healthcare expenditures. This makes this goal number one. This goal will encourage leaders in the community to encourage people to get up and move, eat better, and have their blood pressure and cholesterol checked often. Initiative NWS 8 aims to increase the proportion of adults who are at a healthy weight. Due to the high percentage of overweight people in Safety Harbor, this makes this goal number two. Leaders in the community have worked to make Safety Harbor an active community by keeping parks clean and encouraging activities in the recreation center. Initiative TU1 aims to reduce tobacco use by adults by encouraging smoking cessation and providing education on its harmful effects. Due to the amount of people seen smoking, this is number 3 on the list. Leaders in the community could continue to enforce the no smoking policies near places where people frequent and reduce tobacco advertisement. Safety Harbor adequately provides a variety of environmental resources that meet the social, recreational, and health needs of the community. The Community Center encourages participation of community members by holding meetings and a variety of other events. The Recreation Center promotes fitness by offering a variety of classes for all ages. The City of Safety Harbor is runner friendly and provides an affordable, safe way for people to get up and move and improve physical activity. The safety needs of the community are adequately met by the Fire Department of Safety Harbor, which has 2 fire stations. The Safety Harbor Fire Department is a full-service public safety agency that provides fire suppression and prevention. In addition, they organize a variety of youth public education and programs that help and assist the public in fire and medical emergency situations. Law enforcement is provided by the Pinellas County Sheriff's Department located in Largo. While this is not ideal for the residents to not have a local police department, the Pinellas County Sheriff's Office has quick response times at 3 minutes and 43 seconds. Community members are also able to help improve the environment by the reuse of recycling services and reclaimed water services. An area of concern to the community is the excessive traffic in the downtown area as well as excessive speeding through residential areas. This is a threat to runners and pedestrians. The City of Safety Harbor is governed by a mayor, vice mayor, and 3 city commissioners. The members are able to be contacted through email and will usually respond within 24 hours. The meetings are well attended and are available in person or online to the general public. The budget allows for all aspects of the community, such as government, public safety, infrastructure, transportation, environmental, and community redevelopment. Safety Harbor's 2016 budget focuses on 4 main problem areas such as community education, volunteerism, health initiatives, and department training and professionalism. They are able to meet their budget needs by cutting down on personnel. This creates a challenge to maintain the level of service and offerings. This requires more volunteers to replace the lost personnel. The biggest overall community problem is cardiovascular disease. The amount of obesity in elderly persons are increased in Safety Harbor, thus placing them at increased risk of cardiovascular disease. The risk of Americans developing and dying from cardiovascular disease would be greatly reduced if major improvements were made across the population in diet and physical activity. The list of community problems are prioritized according to perceived or actual danger to the community and its members. Cancer is the second largest community problem in Safety Harbor. According to the Florida Department of Health, 22.8% of people in the area have some type of cancer. Many cancers are preventable by reducing risk factors such as tobacco products, physical inactivity, poor nutrition, and UV light exposure. Sexually transmitted diseases account for the majority of communicable diseases in Safety Harbor. With proper education and safe practices, STDs can be greatly reduced. Heavy congestion and speeding in downtown areas and residential zones where runners and tourists frequent pose a threat to the community. Residents who live on these local roads perceive a danger to children playing outdoors, while others may fear increased auto exhaust pollution, road noise, crime, or hazards. Such concerns can lead neighborhoods to organize in an effort to convince elected officials to take action to alleviate these situations. There is no police department in the city of Safety Harbor. This may make residents feel threatened. The closest police department is located in Largo. The Fire Station 53 provides emergency calls and services to residents who call, and the Pinellas County Sheriff's Department provides law enforcement to the community. The last community problem is that there are no homeless shelters or emergency shelters in the city of Safety Harbor. Although poverty rates are low, there are no homeless shelters in the area, and one must visit Clearwater, which is almost 6 miles away. Pinellas Hope in Clearwater is an emergency shelter. The below poverty level is 9.4% compared to neighboring communities at 15.2%. There is still a need to provide shelters for those who need it. Cardiovascular disease continues to be an important healthcare issue affecting the population of Safety Harbor and the nation as a whole. Cardiovascular disease is the leading cause of death in Safety Harbor, the state of Florida, and globally. 17.5 million people die each year, which is an estimated 31% of all deaths worldwide. These diseases are strongly associated with poor diet choices, lack of physical activity, and smoking. According to official data in China, about 230 million people have cardiovascular disease. In May 2012, the Chinese Ministry of Health, in conjunction with 15 other departments, signed the China National Plan for Non-Communicable Diseases Prevention and Treatment. It was carried out in 2015. In this plan, cardiovascular disease objectives were listed and included decreasing risk factors for cardiovascular disease with the focus on encouraging exercise and healthy eating. The plan stated was to provide guidance for healthy diets and actively develop and promote healthy foods. Safety Harbor started a Let's Move, which is a comprehensive initiative that was launched by the First Lady in 2010. It's dedicated to solving the problem of childhood obesity so that children born will grow up healthier and less likely to have chronic diseases. As part of this initiative, cities, towns, and counties call upon elected officials to adopt long-term sustainable approaches to addressing childhood obesity. In addition, widespread adoption of these goals highlight local action, enable city, town, and county leaders to track their progress. A community health nurse could address the issue of cardiovascular disease by providing education, providing treatments such as medications, and monitoring trends. Nurses have the opportunity to become community leaders in health promotion. Equipped with knowledge and specialized training, nurses are perfect to direct, guide, and implement community initiatives. Nurses must help with policy change and involve themselves in implementing diet modification and increasing physical activity.